Good morning. Welcome to our weekly COVID briefing from the State of Utah COVID response. My name is Joe Doherty. I'm the Director of Public Affairs for the Utah Department of Public Safety. Our speakers today for December 17th, 2020 will be Governor Gary Herbert, Dr. Angela Dunn, our state epidemiologist, and Rich Saunders, the Director of the Utah Department of Health. Now, due to another engagement, Governor Herbert will be here to make an opening statement, and then we will be excusing him, so he won't be available for any questions. But we'll turn the time over to him now, Governor Herbert.
Well, thank you, Joe, and welcome. Good morning to everybody. We're honored to have you here, and thank you for your participation. I hope the weekly briefings have been helpful, particularly the people at large. We appreciate the media making this available to them and facilitating these opportunities for us to talk to the people directly. Again, this pandemic has been a challenging time for all of us. These last 9 to 10 months have been challenging, and we're all kind of weary and frustrated. But I'm grateful to see, the first convoy of the vaccines that have arrived and people actually being inoculated. I think that gives us all hope and optimism about the future. So again, good things are starting to happen, and again, we appreciate the good work of the people of Utah in being patient and helping do what they can to help slow the spread of this pandemic, and we're to the point where now we're going to see some turnaround, and I think 2021 will be a good year. This morning, we're going to announce some changes in some of our policies regarding COVID-19. I'll announce a couple of these changes. Those will be amplified a little bit by our Director of the Department of Health, Rich Saunders. But I know many people have been curious and have been interested in knowing what we're going to do when it comes to alcohol policy at our bars and restaurants. As you know, we've tried as a state to make sure that we've had that balance point of helping people protect their health and ensure that health is being a number one concern, at the same time not shutting down the economy. And we've done a pretty good job of finding that midpoint, that optimal point of doing things in our state, I think better than most any other state in America. At the same time, our hospitality industry has been really hurt hard. As of today, they're down about 16.7% from what they were a year ago. It's been lower than that. The trend actually is improving, and that's good news as we see economic improvement in all sectors of our economy, but still a challenging time for those in the hospitality industry, our restaurants, our bars in particular. So we've met with them recently with the Utah Restaurant Association, with owners of a number of bars and restaurants and combinations that they're concerned about what's taking place with the alcohol restriction. And talking to them and understanding their situation and what they're willing to do, we've come up with their commitment that they're willing to, in fact, enforce physical distancing in the bars and restaurants, making sure that people are required to wear masks when they're not eating or drinking, and when they are eating and drinking to do it in a stationary environment, not just walking casually through the restaurant or the bar with a drink in hand. So with those protocols, we think we can minimize the risk in that setting. And so consequently, because of their commitment to do those things, we are going to, in fact, remove the restriction on alcohol sales after 10 p.m. effective tomorrow, December the 18th. So I know they're going to be happy about that, and we appreciate their willingness to step up and help enforce protocols to make that bar and that restaurant a safe environment for their patrons to come and participate in. Secondly, again, one of the things that's been one of the most challenging issues for us as a state is how we do our educational system. We've seen the surge that came in place when we came back into school in September, and the challenge that presented to us as we had rising case counts and numbers, and of course the fallout of those numbers with hospitalization and even death. Our schools are about to go on winter break. We have accumulated a lot of data. We found a few things that are important. One, schools are actually a less risky environment. The supervision that takes place there, the protocols are being followed. Mask wearing is helping to make that a safer environment. And so we're going to make some announcements here now so that the school districts throughout the state can understand, prepare, and be ready after they come back into school after the first of the year. First, we're going to change the quarantine guidelines for COVID exposures that happen in school. So if a person is in close contact with someone who tests positive, and both people are wearing masks, no longer does the one in close contact have to be quarantined. They'll be allowed to stay in school while that one that has the COVID-19, of course, will go home and be isolated until they get better. Masks are the key element here. Mask on mask, as we call it, is what we should have. If both people are wearing a mask, it qualifies as a low-risk exposure. That's what the data shows us. The people that have been quarantined, we found about 1% is all that end up showing symptoms of the COVID-19 that have been quarantined. So this can provide a safe opportunity for students to continue to have their instruction, less disruption for the teacher in the classroom, less disruption at home for parents, and particularly for single parents. So this, we think, is going to be a win-win. We still want you to know that for those who are not wearing a mask, again, if you don't wear a mask, then the current standards of quarantine protocols will still apply. So again, emphasize the importance of everybody in the classroom to wearing a mask. Schools will still be required to do contact tracing to determine the mask wearing situation, who's involved and who the close contacts are. But for those that are involved, we certainly want them to watch for symptoms and immediately isolate and get tested if in fact symptoms develop. We would understand that some teachers would be concerned about this change. Again, they're worried about being in a riskier environment. The good news is the data shows us that they are in a low-risk environment at school. And again, we're trying to provide opportunities for the teachers to have some extra levels of protection and assurance. For example, we've provided them now with opportunities to be tested at their desire. They can be tested every week. It's at their request, and we'll make those tests available to them. And we, in fact, are making sure that they're in the first wave of those who will receive the vaccine. So right after the healthcare providers are inoculated, teachers will be next up. We hope that teachers will start receiving vaccinations by the middle part of January. And that will, again, hopefully give them some assurance and help with morale to know that we do appreciate, as a state, as a community, as the people of Utah, the good work of our teachers in very difficult circumstances. They're on the front lines. And again, it's significantly important that we have schools and our students getting a good education. They are the hope of the future, and they need to have skills and training and education to be able to magnify their opportunities in the marketplace. So we again appreciate the work of the teachers. Last but not least, let me just say a few things in closing here. Again, the fact that we are seeing now some daylight at the end of the tunnel with the arrival of the vaccine, I think is encouraging for all of us. But I would caution us all to make sure that we understand this tunnel is still long. And there's still ways to go before we can relax on our protocols, which means that all of us should continue to make sure that we social distance appropriately, that we wear a mask covering. Again, it minimizes your risk, not at zero, but it minimizes the risk of transmitting and catching the virus by between 70 and 80%. So mask wearing should continue. We should not relax in that regard. Again, proper hygiene, washing your hands, all the things that we know ad nauseum need to continue. And we hope that the vaccines are going to be made available so that by springtime, as the volume of supplies increase and our distribution system is in place. And by the way, you can go to coronavirus.utah.gov/virus, and you can find out what the inoculation, /vaccine, coronavirus.utah.gov/vaccine, and you can see how we're going to deploy it and how we're going to vaccinate people throughout the state. But we would hope that by springtime that will be made available to everybody, and by summer, everybody that wants to have a vaccine will have a vaccine. So that's good news for all of us. I would encourage all Utahns to take advantage of the opportunity to get inoculated as soon as you can. I believe the vaccine is effective, minimal side effects. I think opportunities for us will be to get that. I know that I want to get it as soon as I'm available to receive the vaccine myself. The good news is we see some hope and optimism for the future. Don't relax. Don't become complacent. We know we have lag time for these issues with hospitalization and death, but the holiday season, we're in the middle of it, and we want to continue to stay the course through the new year. If we do that, 2021 is going to be a great year for us, a great year of recovery. So Utah, stay the course, do the right thing. We're going to get out of this together and have a happy new year, because 2021 is going to be the recovery year that we've all been praying for. Thank you, good luck, and God bless.
Good morning. Our rolling 7-day average of new cases is 2,570. This is a decrease from last week when we were at 2,816. Today, we are adding 3,203 additional cases. Our percent positivity is now down to 22.3%, almost a 4% decrease from last week when we were at 26.2%. However, our hospital ICUs are continuing to operate at capacity. They're finding ways to treat critically ill patients beyond their standard ICU capacity. And unfortunately, we are adding an additional 30 deaths today in Utah due to COVID. This is a tragic reminder that while there is a lot of hope on the horizon with the vaccine, we still have quite a long ways to go, and we need to continue being vigilant to protect individuals against unnecessary illness and death. So that means wearing your mask, limiting your close contacts, and staying home when you're ill. On our data dashboard, today we're going to start including information about our vaccination efforts. We're able to report out the number of vaccines shipped to Utah and administered in Utah. There are some things to keep in mind as you look at this data. So today on the dashboard, we're reporting 470 vaccines have been administered in Utah. This is just the first dose of a 2-dose series of vaccination. Also, facilities are required to report vaccinations administered to the Utah Department of Health within 24 hours of being administered. So as people start to receive their second dose of vaccine, we will be able to report the number of individuals vaccinated in Utah and also basic demographics about who is getting vaccinated and where they live. This is really an exciting step forward in our ability to control the pandemic. But please, as we move into further of our winter holiday season, it's so important that we continue to limit the number of cases, and we all can take individual responsibility for that. Our hospitals need us. They can't tolerate yet another surge after the December holidays. So please continue to limit your close contacts, wear a mask, and stay physically distanced. I hope you all have a very wonderful holiday season. Thank you.
Thank you, Dr. Dunn, Governor Herbert. It's good to be with you today. There is much good going on in the state of Utah. We're grateful for the great work of so many and for the cooperation and support of the people in the community and organizations that have helped support the response to the COVID-19 pandemic. We have one county that will change transmission index levels today. Unfortunately, it's moving in the wrong direction. Rich County will move from the low transmission level to the high transmission level based on the county's 14-day case rate and the 7-day percent positivity. This makes 26 counties in high and 3 counties will be in low. Last week, we acknowledged the important role of educators and the role that they play in the communities by ensuring that teachers and other staff, school staff, have prioritized access to the COVID-19 vaccine. And this week, we're continuing in that effort as we, in our response to help schools and the kids in the schools to have the best educational experience possible. We've learned a lot since the beginning of the pandemic, and it's been a painful but very productive learning process. We know that students, we know that students and staff who've been quarantined due to masked close contact and have been for COVID-19 have been tested. Those that have been quarantined are estimated to be 1 to 2% positivity rate. So to the governor's point, we've perhaps been quarantining too many. And so those adjustments that were made today are based on this data. We also know that when we've tested nearly 2,700 students and staff, as you may recall, as part of the high school football playoff initiative, only 3.2% of these individuals tested positive. We also know that the case rates among elementary and middle school students are lower than the case rates among high school students. We know that rapid testing can reduce the risk of infection by finding positive cases and being able to immediately remove them from the transmission pool. We've also learned that ongoing or reoccurring rapid testing influences safer behavior among those who anticipate being tested. This has been very helpful. We also know that masks work. As much as I don't like wearing them, I wear them every day when I'm in certain settings because I know they work. So based on what we've learned and what we know, we will extend the public health order dealing with mask requirements in K-12. And we're also making a few adjustments to policies and to the public health order that's set to expire tonight at midnight. Both the K-12 mask requirement public health order and the current public health order will be renewed or extended through January 21st. And this gives us a little time after the kids, the students and staff come back into school to be able to monitor what's going on with the situation. The statewide mask requirement will continue regardless of the transmission index level. So this is statewide across all counties. In addition, the following K-12 school policy changes will take place and be effective the day that school resumes after the holiday break. Our office has coordinated and discussed these changes very broadly. We've discussed them with the school board superintendent, or the school superintendents, the School Boards Association, the PTA, the Charter School Association, the Principal Association, the School Staff Association, and the consensus among all these groups was support for the changes that we have announced and that I will go over now. Included in these changes was the new quarantine guidance announced by the governor in just a few minutes ago. We're recommending that we adopt a new modified case threshold for determining when to act when there's an outbreak at a school. So schools that have a population of staff and students more than 1,500, the threshold that we are recommending is 1% of the school population. Schools that are less than 1,500 students and staff, the outbreak threshold will remain at 15 cases. Also, the classroom threshold that we have had up until this date will now, we recommend, only apply to the elementary schools. Schools that reach the outbreak threshold will have two options, and we're referring to option number 2 as the test to stay option. One option is that they can move all students to virtual learning for at least 10 calendar days. Or the test to stay option, the protocol, this is the protocol that we established in a pilot test in Davis and Granite school districts earlier this month. Under the test to stay protocols, all students and staff are they're offered the chance to receive a rapid antigen test. This is if that threshold is met, then all students and staff are offered antigen tests. Students who test negative can continue with in-person learning. Those who test positive or those who choose not to be tested will move to virtual learning for 10 days. Positive cases identified through test to stay will not count towards the school's outbreak threshold because all the positive cases or those who don't want to be tested will move to virtual learning for 10 days. The purpose of test to stay is to promote consistent and safe in-person learning, as opposed to oscillating between virtual and in-person. What we wish we could do in school What we will do, just as we're looking at the big picture, we're trying to make sure that we don't reproduce what happened in late August and September. And so this test to stay is critical in that we wish we could test every student going back to school, but the logistics and the resources it's just not possible to do that. But what we will do is offer targeted testing to schools and their surrounding communities experiencing outbreaks after the holiday break. So we're offering this support to schools and hope that they'll take advantage of the option for this testing blitz as needed and call upon us to be able to help support them that way so that we can find positive cases in the community before we get too far into the new year. I think it's important also to know that we'll continue with the test to play protocols that we have introduced toward the end of November and that have been very successful. We've seen a high level of participation in this. It's very flexible and very sustainable, and it's helped us to get a better understanding of the prevalence among these students and staff. So we've performed nearly 12,000 tests on these populations, and among the students and staff, we've found a positivity rate of just 1.6%. So we do expect, regardless, that all participants in high school sports and in-person extracurricular activities to follow the latest Utah High School Activities Association safe participation guidelines. We're grateful for them putting these together. The guidelines emphasize the importance of wearing masks at all times, unless actively engaged in competition that requires heavy physical exertion. We also want to make sure that every school teacher that wants to be tested for COVID-19 can be. Schools should offer testing to all teachers and staff who want to be as a part of the test to play program, regardless of the teachers or the staff's involvement in extracurricular activities or sports. All of this information about the test to stay and the test to play is now or will very soon be updated on the coronavirus.utah.gov website. Let me address colleges now. I think it's important to understand, and for all college students and staff to understand, that when they return from the holiday break, each one of the students in higher education will be tested within the first 10 days of the return to campus after the break. I think that's important because it'll help students to watch their behavior during the Christmas break and be able to be in a position to more safely return to school and have the chance to test negatively when they are tested. The updated public health order requires most colleges and universities to follow the testing model developed jointly by the University of Utah, Brigham Young University, and the Utah Department of Health. The goal of this model is to catch as many cases as possible when the school resumes in January, so positive cases can be isolated before students start socializing. This is another important emphasis that I want to make here. As we implement this testing protocol, we are calling upon the leadership of institutions of higher learning to make every effort to help students who live on campus or attend classes on campus, for these leaders to limit gatherings of students of different dorm rooms or households as much as possible. We also want to call upon them to limit the number of public gatherings of students until we've been able to complete this 10-day testing blitz on all returning students. These measures are implemented in order to reduce, as I've said earlier, the risk of repeating the surge that happened in late August, especially given that we are at such a high baseline of cases today and the hospital systems are so volatile at the current day, as Dr. Dunn has explained. I would like to personally just express thanks to Willie Lanier, Nate Checketts, and the teams that surround them for helping the higher education and the K-12, all of the stakeholders in this Herculean effort to put this together. And also Dr. Dunn and many others who have helped to organize and to guide this effort. As we look forward to the upcoming holiday season, I personally am comforted at what happened during the Thanksgiving break. We all came back and expected that there would be a pretty significant surge, but that did not happen. And that's because of what you did to modify your behavior and to make adjustments necessary to cause that the surge did not happen. Thank you for that. Thank you for thinking, being conscientious, and making the right decisions in our relationships. I am asking everyone to recommit to these behaviors over this coming holiday season. The arrival of the vaccine in our state has lifted the state's spirits. But let's continue to be vigilant in the basic behaviors that we have proven to work in the state of Utah. Happy holidays to all of you. And I believe that at this point we'll take questions.
All right. Thank you, Rich and Dr. Dunn. We're available to take questions now for the two of them.
Hello, it's Sean Means of the Salt Lake Tribune. How are y'all? Question for Dr. Dunn and Dr. Saunders. What protocols are in place to make sure in these early days that the frontline workers who need the vaccine are the only ones getting it? There's always a public perception in times like this that the rich and well-connected will jump the line. What are hospitals and the health department doing to make sure that doesn't happen, particularly as the vaccine starts becoming available in nursing homes?
So the vaccine doses we have already received are shipped directly to our hospitals. And so our healthcare systems are responsible for giving those out to their healthcare providers in an appropriate way. And so that's our safeguard, right? They're sitting in the hospitals and healthcare systems right now.
Hi, this is Jacob Klopfenstein with KSL.com. For either one of you, obviously, 30 deaths today is a pretty harrowing number. I mean, do you expect this to continue getting worse, or are we starting to see a decline? Will we start to see a decline in deaths from that surge in November, or
Right.
What are you kind of expecting as far as what we'll see in deaths over the next few weeks?
Yeah, so the deaths we reported today happened over the past 4 weeks. And so, like you said, I think these are directly related to the surge we saw in November. And we can anticipate better days ahead because we have been decreasing our daily case counts and thus we'll have fewer deaths.
Hi, this is Haley Hendricks with ABC4 News. It's a question for either of you, but you announced some new changes today involving K through 12 schools. What is the goal with these changes, come next summer, by the end of this upcoming school year? I mean, what would you like to see?
I'm assuming you're specifically referring to the quarantine changes, or can you be more specific on the changes you're referring to?
I mean, you have a list of changes. You've got these quarantine guidelines, test to stay. I mean, would you like to see the virus be taken out of all schools? I mean, you say that risk level is low, but would you like to see that get lower?
Yeah.
With these changes, of
What
course.
we're looking for is a safe transition from where we are today to the day when we can not be so conscientious about wearing masks, not be so concerned about the risk level, and that life resumes kind of a more new normal level. So the strategies that we've put into play are designed to kind of balance the efforts of testing, how do we quarantine, how do we stop the transmission from occurring while vaccination occurs on a broader and broader level, so that we can work these two and three strategies together. We don't ever, I don't know that we'll ever get to the point where, and Dr. Dunn can talk about this if she'd like, but I don't know that we'll ever get to the point of no cases or no risk, but it's just a matter of moving to the level that is a more normal way of living. So that's kind of what, from my perspective, our strategies and our efforts are aimed at that.
Thank you very much.
Hi there, it's Ben Winslow from Fox 13. This is a question for either Director Saunders or Dr. Dunn. A number of school districts are starting to notify teachers and educators, staffers that they may be getting the vaccine as soon as after winter break, mid-January. I'm wondering, with more vaccines becoming available, more doses being shipped to Utah, are you speeding up the timetable for when the general public might be able to have access to the vaccine?
Yeah, I mean, right now, we have an idea of how many vaccine doses we can anticipate. We don't know exactly, right? There's things that are changing constantly, but absolutely, if we start getting a lot more vaccine, we will get it out quicker and we will start transitioning through our phases more quickly and hopefully to the general public even quicker. So absolutely, that will speed up our timeline. But again, we don't know until we actually get the doses, and then we're able to plan for it. But I will say that we are building the infrastructure to make sure that we can handle if we do get more doses more quickly than anticipated, so that we can get through the phases quicker.
Just another comment to add to that very appropriate response. We have teams that are literally looking at pro formas of when vaccines will arrive, who they go to, and how fast can those locations administer the vaccines. And we're also looking at how to better communicate to the populations that are on deck to be vaccinated next. We've also got a team that's working on do we have the right prioritizations? Even though we've established kind of a basic priority structure, we're still trying to evaluate as we move through this whether or not that priority structure is the way that it should be. And it may adjust and change based on what we learn through this, and so that's to be expected. But the biggest key for us is, when will we get the vaccines? Who needs to receive those? What points of administration need to receive those? And how do we get those locations, those vaccine points, onboarded ahead of the vaccines so that we can administer the vaccines and we're prepared to administer them before they arrive. So that's the biggest work of our team right now, is to build, as Dr. Dunn said, the infrastructure to be able to handle increased doses. We're also trying to hedge for what if we have new manufacturers come on board and those manufacturers add to the dosage, the quantity of doses that we receive as a state. How do we go from our current pace of distribution to a much elevated pace of distribution? So those are all of the things that we're working on as an agency right now and across with all of our stakeholders.
Hi, this is Sonia Hudson with KUER. I have a question about testing in universities once they return to campus early next year. There's the requirement to get tested every 2 weeks. Do universities have enough testing supplies to make that happen, or do we still need to ramp up distribution to universities and colleges?
So our commitment, and we've been hedging for this for quite some time. The state is gathering as many of these rapid tests as we can get, and our commitment to the institutions of higher learning is to continue to provide these tests for them. There have been most of the universities have sufficient testing supplies today to be able to take a significant step forward in the plan. So there will be an ongoing need to manage the inventories and to be able to move them forward in time for the institutions to utilize the needed tests. Oh, yeah, one other mention too is that we have moved away from the requirement of every 2 weeks, every 14 days that a college student is tested. And instead, the institutions will be required to follow a certain testing model that involves a certain speed of testing symptomatic people within 24 hours. It also includes this back to school testing. It also there's a certain model that the universities have gotten together to create that helps us to perform randomized testing to look at two things. One is, what is the prevalence in the campus community, as well as how do we find positive cases and remove them from the transmission pool. So there's a certain model around that. We also, as a part of the testing structure, we have an option for them to do more targeted testing based on what they're learning through these random tests, and also the requirement to test close contacts to positive cases. That's one of the methods of being able to quickly find highly likely or more likely positive cases and be able to remove them from the transmission pool. So instead of every 2 weeks for every student, this kind of a model is what is expected at each of the institutions to take place.
Briefly explain why you moved to that model over the 2-week testing requirement?
Yeah, it's really simple. The logistical requirements and the resources are simply not available to do otherwise. And so
you didn't have enough testing supplies of tests to make that possible.
Yeah, and yes, and just the logistics on campus to be able to move that kind of volume through consistently is really difficult. So what we've done is the next best thing as we put the minds together, we've done the next best thing, which is to create this randomized model that helps us to detect a 0.5% change in the prevalence so that we can take, the universities can take, or the institutions can take action based on what they're finding. So again, and through the close contact requirement of testing, being able to understand prevalence and make adjustments based on what the prevalence shows, and also to be able to find these positive cases as efficiently as we can, all the while the vaccine moves forward across the population.
Thank you.
Good morning. This is Jed Bowl, KSL TV. There's been some national reporting last night and early today on Pfizer vaccine vials arriving with more than the expected 5 doses, arriving with 6 doses, 7 doses in some of those vials. Are we seeing this in the arrivals here in Utah with the vaccine, with the Pfizer vaccine? And if so, are the hospitals able to use that in their shots that they're giving to their frontline workers now? And if so, what kind of difference can this make as the vaccine rollout continues?
Yeah, all very good questions. I'm not aware of the specific situation here in Utah. I do know that there are reports that Pfizer has more than 5 doses in a vial, and we're awaiting FDA recommendations on how to use that, and we recommend that our healthcare systems continue using their same protocol that they've been using and had in place prior to vaccine administration. So more to come on that, Jed.
We'll have time for 2 more questions.
Hi, this is Wendy with Deseret News. I just wanted to know if you're actively tracking the demand from the public for the vaccine. Do you know how many people plan to get it, or will these vaccines ever end up sitting on the shelves?
Yeah, exactly. So we have a telephone behavioral risk factor surveillance system that we've added questions to about the COVID vaccine and the acceptance of it. So we do have an idea of what the likelihood is of people to accept the vaccine. So I will tell you that about 70% of Utahns definitely will or are somewhat likely willing to get the COVID vaccine, which is fantastic. And that was done several weeks ago. So I anticipate confidence will grow as the vaccine distribution carries on. And so I think we're at a really good starting point in terms of being able to achieve herd immunity once we get to that mass vaccination distribution.
Yeah, this is Paul with the KSL News Radio, and I've heard you mentioned that there were some students that came into close contact with kids who did have COVID-19, but you mentioned that maybe that you were quarantining too many. And there are some people that might look at it as and say, better safe than sorry. Is there any real kind of problem with the notion of having kids isolate themselves for a few days, having too many kids isolate themselves for a few days while they wait for their test results to come back?
Yeah, I'll comment on that, and then Dr. Dunn, please feel free after. It's a huge disruption to the kids' lives and the learning environment. And so what we're trying to do is say, what really do we need to do with the quarantine aspect? This is based on the data of just over 1% of those that are quarantined, and we've quarantined thousands and thousands of kids. About 1% of them have been tested positive that have been in close contact. The key is the mask on mask is the qualifier. And so with that, the risk becomes very low for transmission. And so under those circumstances, in an effort to try to create very smooth and less disrupted learning, this is the outcome of all of that effort. So Angela, why don't you comment further?
Yeah, I mean, the whole point of this is the low risk exposure. So again, our data has shown that throughout this fall, when kids are exposed in a classroom and everybody's wearing masks, the risk of transmission is very low. And so when we're weighing the risks and benefits of the disruption of kids, not being in school, transitioning between in-person and virtual, the benefits of kids staying in school outweighs the risk of that transmission. And again, we have spoken with all the necessary stakeholders to make sure everybody has the ability to be aware of what those risks and benefits are and come to the table and express their opinion. And so we feel really good about this moving forward into the next semester, that kids can be in person, staff and teachers can be safe, and we'll continue to monitor to see if further adjustments are needed. But we feel really good that this is a safe way to go.
All right, thank you, Dr. Dunn and Director Saunders. This will conclude the briefing for today, December 17th. We thank all of you for participating. We wish all of you happy and safe holidays. Remember, the safest gathering is the smallest one you can do during this holiday season. I'm happy to report that on the coronavirus.utah.gov website, the new data for vaccine distributions is already live right now, so that'll be data we continue to update. So that'll conclude our briefing. Thank you, as always, to our interpreters for ASL and in Spanish, and we'll talk to you later.